If you've ever wondered about wisdom teeth, do you need them? Do you not need them? Should you get them taken out? Are they a problem? This, my friend, is the episode for you. Welcome back, everyone, to another episode of Your Mouth Matters. I'm here with the amazing, incredible Dr. Rebecca Taylor.
Hey, guys.
And we're talking wisdom teeth today because it's a topic that comes up quite a bit in the clinic.
Yeah, so we're going to drop some wisdom on all of you today.
Boom.
Another t-shirt idea, Barry. Because, we get this question a lot, and I think that there's a lot of misinformation about them, and a lot of people come into me for second opinions after they've been told by their dentist that they need to have their wisdom teeth extracted. And so anyways, I just kind of want to dive into it. I'm not against wisdom teeth removal. I'm not necessarily for wisdom teeth removal unless there's an issue with them. So everybody's going to be different. We have to remember the idea that we just automatically, when we turn 17 or 18 years old, just as a rite of passage, have to have our wisdom teeth out, to me is just such BS, right? What other body part are we oh, now you're 17, so we're going to take your pinky finger off because it just doesn't fit quite in this glove the way we would like it to because your hands have grown. That's just not a thing. There's no other body part where we're okay, time to get these out. I know for me personally, I think I was 17, and they were okay, time to get your wisdom teeth out. Do we know if they would have fit in my mouth? Nope, because we didn't even wait to see. And we just assume, okay, it's time for you to have them out. Here's the deal with wisdom teeth. Wisdom teeth are the last teeth that come in. Okay, we get them, it varies, but some people when they're 17, they come in, but they're usually come in your early 20s. They're the last teeth that come in. Because we have had issues with our jaws not growing properly, which all stems back to the breathing and other podcasts, we talked a lot about facial growth and development. But because of the lack of growth in our jaw and the improper development that has happened when we're kids and we're growing, that means that when the wisdom teeth come in, if there's been an issue with growth, that they may not have space. So a lot of the times they get what we call impacted. And impacted means that those teeth are basically shoved into the bone sideways, just barely fitting in there. And there's just no way that they can come in. There's no path for them to come in. There's no space for them. And the issue with impacted wisdom teeth is that they can become infected, okay? Or sometimes wisdom teeth will come halfway. And then the gums around them get really inflamed. It's hard to keep them clean. There's just a lot of inflammation that's going on. And you can actually get pretty big infections around these wisdom teeth. And if you have a situation where you have to remember, most of our growth in our face is done by age 8. So if we're not catching that growth issue really early on and addressing breathing and all of that, the odds are that when you're 12, 14, 16, probably we're not going to be able to make space for your wisdom teeth just because we've completely lost out. We've missed our growth opportunity, right? So if you have a wisdom tooth that comes in partial way or is impacted, in that case, I do recommend removing them because they can cause big infections. And when a tooth is not fully in, it's usually pushing on the tooth in front of it. And I have seen cases where they didn't take the wisdom tooth out, they couldn't keep it clean, and then they end up losing both their wisdom tooth and the tooth in front of it because the wisdom tooth becomes so infected that it actually infects the tooth in front of it. Sometimes if you don't address an issue with the wisdom tooth, you got big risks with the tooth in front of it. And that all of that risk depends on where the wisdom tooth is in the mouth. Is it all the way in? Is it halfway in? And if there's an infection. And so this is why CT scan, 3D X-ray imaging is super important because we can see what is going on, where the tooth is, where the other tooth is, where is there infection, is there bone. If you have an infected wisdom tooth, a lot of times you'll have pain in the jaw. You might notice red puffy gums. It can be quite uncomfortable. So for patients that have that type of thing going on, I'm always going to recommend that you remove them. Now, this is where I really don't agree with a lot of dentists. A lot of dentists they don't like treating wisdom teeth, okay? And I don't blame them. They're really hard to get to. My dad has all 4 of his wisdom teeth and also has lots of cavities. Always has, and probably always will, because he's not willing to change his lifestyle. So with him, when I was in dental school, I was identified that he had some cavities on his wisdom teeth. So I had to take out old fillings and put new ones in. I could not see anything. I was literally drilling his tooth, and it was all by braille. Like, I would drill, and then I would take my mirror and I would check, and it was really hard, very frustrating. And I told him, I sat him up after I was finished, and I said, Dad, I think I got a really good seal on that filling. I never want to do that again. And the next time that I look at these, I will be removing them because it's not fun. It's really not fun to work on these teeth. So I don't blame dentists for being like, hey, these just need to come out. However, if your wisdom teeth are fully erupted and you have top and bottom and they are in function, they're biting, they're in function, there's no infection, there's room for them, and you can keep them clean, there's no reason to take them out. I had a patient last week come in, a situation like this, where she just had, her wisdom teeth were just like functioning, and she had a small little area that, like a little tiny cavity that was actually pretty easy to access. And her dentist said, I'm not going to touch that because they all need to come out. And I don't agree with that. If you have a tooth that's in function and it's relatively, easy to access, you can keep it clean, like I said, there's just no reason to really remove it. Doesn't make sense to me why you'd remove it, besides just the fact that historically dentists have said, oh, your wisdom teeth, let's take them out. Okay. So there you go. Now, there is a right way to take wisdom teeth out and a wrong way. We've talked about this in podcasts before, because if you remove a wisdom tooth and you don't remove the whole ligament, if you're not cleaning that socket out really well and placing PRF, which is platelet-rich fibrin. Platelet-rich fibrin is awesome. It's actually from our own bodies. So if a lot of people have heard of PRP, platelet-rich fibrin is like PRP on steroids. It's so much more potent. So what we do is we draw your blood, we spin your own blood down, and then we use the white blood cells basically separate out from the red blood cells, and it creates this little, we call it a slug. And it looks like a slug. That's why we call it that. And we take that, we compress it and make it super, super dense. And then we put that actually into the socket where your wisdom tooth came out. And then we suture everything up. And we also do laser and ozone therapy to just really make sure that that area is clean. So what that's going to do is that's going to stimulate proper healing of the bone. So a lot of times when wisdom teeth are removed, the dentist kind of pops them out, you bite on a gauze, stop the bleeding, and then they send you home. If there's, like I said, though, if there's any ligament or anything that's left over, then that area is not going to heal properly, and that can actually create what we call a cavitation. And a cavitation is like this pocket in the bone where the bone does not fully heal. So the ligament of the tooth is, the tooth is attached to the bone via a ligament. It's called the periodontal ligament. And this ligament tells the body, proprioceptively tells the body, there is a tooth here. And so if you don't remove all of that ligament when you remove a wisdom tooth or any tooth, but if you don't remove that ligament fully and remove all of that, then the body never gets signaled that there's not a tooth there. And so what happens is that healing process, that rebuilding of bone and that filling in of that hole is compromised. And the reason why this is an issue is because there is the opportunity then for different microbes to find those areas where there's less blood flow and set up shop. And a lot of times we'll have patients that will come in and they have these cavitations from, we call it altered healing of a wisdom tooth area. And that altered healing area, when we open it up, it'll be like oil. It's just like spilling out of the bone. It's wild. You can see just like this oily substance coming out. And that's all infected bone. That's a bone that did not heal properly. So we want to make sure that if we are removing wisdom teeth, that we are doing it the right way and taking extra precautions because if you don't do it, it could cause a cavitation, and a cavitation has all sorts of other impacts on our total body health. I've seen patients that have had cavitations where once they had like chronic sinus infections, like their whole life, like can't figure out why they have sinus issues. And then they take care of their cavitation, get that treated, and then their sinuses, they can nasal breathe. Their sinuses are so much improved. When you have this pocket of infection and it's going to affect your systemic body. I don't know how. I don't know what it will be. But anytime that you have a chronic infection in your body's always going to be happier without it. And so I think that's like the biggest takeaway with really any type of tooth extraction. But because wisdom teeth are so commonly extracted, we so commonly see cavitation areas and altered healing in these areas. So my big PSA is first of all, if you actually need your wisdom teeth out, there should be a reason. Okay. And it shouldn't just be like, because that's not a good enough reason. And if you do need them out because there is an actual reason, you have to make sure that you're going to a dentist that is going to remove the entire ligament and use other things like ozone laser to really make sure that that bone is clean. And 100% of the time, they need to be using PRF. So you got to have that done. That will greatly reduce the risk of having a cavitation later. And you're going to be, that bone is just going to be a lot healthier if you do it that way. If you do have a cavitation, because let's say you're listening to this and you're like, oh man, I had my wisdom teeth out when I was 17 because my dentist told me that it was time and it was my rite of passage. So if you had your wisdom teeth taken out and you're not sure if you have a cavitation or if your bone healed properly, we can see this on our 3D imaging. And we do this at every new patient appointment. And if you come into my office and your chief concern is wisdom teeth issues, we are 100% of the time going to need this type of scan so we can see what the bone density is. We also send our CT scans off to a radiologist and have them review, and they will also note areas of potential altered healing. And so we'll go ahead and identify those areas. And then if we have to treat those areas, it's actually a surgery. So because there's like this pocket in the bone that's infected, basically what we have to do is we have to cut the gums and we have to go through the hard plate of bone, the cortical plate, and get to that area that's infected. And we have to clean all of that mushy, oily bone out and then fill that hole with the PRF that we were talking about. So the biggest thing is just do it right the first time, because if you don't do it right the first time, then you might need more surgeries. Spend a little extra money, take the time to really make sure that your doctor is like doing it the right way, because if you don't, then later you could be looking at needing more surgeries, more expense, a lot more expense. Not a lot of dentists do cavitation surgeries. We're super lucky because Dr. Isabel at our clinic has a lot of advanced continuing education in this topic. We have patients that come from all over the United States for this type of treatment because it's not a treatment that most dentists typically do. And anyways, anytime that you can treat it the right way first, I'm always a fan of that because it will potentially save you a lot of money and an additional surgery and the healing that goes along with that. So do it right the first time.
And along those lines, for someone who maybe has younger children and maybe they haven't caught one of our earlier episodes that we've done around dental development in our youth, if you're kind of proactively, preemptively wanted to be aware of wisdom teeth issues, potential issues, growth issues that could impact the wisdom teeth, when should that be hitting a person's radar?
I like seeing kids as soon as I can get my hands on them. Even like seeing babies is great because I can actually identify issues in even a newborn baby. I can see if there could potentially be a growth issue that's going to happen. Our growth, the growth of our jaw is stimulated by actually our breathing. And so and in our tongue position. So if we are babies are breathing with their mouth closed, if their tongue is up in their palate, if they don't have a tongue tie, if they don't have lip ties, all of those things are going to help their faces grow properly. If kids are chewing their food and they're actually exercising their jaw muscles, that's also going to help stimulate proper growth. We live in a society now with purees and applesauce and, we do mac and cheese and white bread sandwiches, and we're not really using our jaws like our ancestors did. So we really want to go back to a more ancestral diet. We want to make sure that kids are eating and chewing food. My daughter, if I chop up her steak, she does not eat it. But if I give her like a gigantic piece of steak, she loves like ripping the steak off. And that's because I have just taught her since very early on to chew. And so getting your kids chewing, I've got stepkids that I met when they were a little older, and we'll have kale salads some nights, and it's like they're just complaining that their jaw is so tired from chewing this kale. And you're like, it's good for you. So even like having kids chew like hard gum, like there's a gum, it's actually called Falim, and you can get it on Amazon, and it doesn't have any sweetener, and it tastes like an eraser. So it doesn't taste amazing. Although when I tell kids like, hey, your homework is to chew gum, they just light right up. They're super stoked about it, but it doesn't taste good. But that gum is so hard. It doesn't have sugar, and you probably chew the same piece for like a week. It just does not run out of its chew. There's also things like Myo Munchie, which is designed for like babies and kids. And it was actually designed and developed by a chiropractor. And that device is also made for chewing. There's things like Myo Brace, which are really treatments that are really function based. Myofunctional therapy is an excellent treatment. That's also going to help stimulate those jaw muscles and get the jaw moving. And then of course, like we talked about, ancestral eating. So to grow bone, you got to have the nutrients, and that means that your kid's gut has got to be absorbing the things that you're putting into their body. So you got to make sure gut health is good. So there's all sorts of things. If you bring your kids into me, we will talk about all of these things. We have other podcasts that go into more of these details. But yeah, when you zoom out and you look at wisdom teeth as we got to treat the root cause, how do we get it so that these wisdom teeth are fitting? What it boils down to is that the jaw has grown properly, and most of that growth, like I said, happens before age 8. And so you got to work with your kids during that optimum time to get the best outcome. And unfortunately, a lot of times people will bring their kids in to the orthodontist or something when they're like 9, 10, and it's okay, am I ready for my braces? By that time, you've missed a lot of that growth window. And so we probably aren't going to be able to catch them up enough to save the wisdom teeth. But if you catch them young, like if you catch them and identify an issue when they're a year old or 2 years old or 3 or 4, we can do a lot more, and hopefully we can make room for those wisdom teeth. This is really more about the jaws and the bones growing correctly, right? This is not orthodontics. Orthodontics is moving teeth. This is about growing bone. So it's orthopedics. So we need to make sure that we encourage proper growth with orthopedic types of treatments. So that's really the solution to how we prevent this issue. But you have to remember, hundreds of years back in the 1930s, there was primitive populations that Weston Price went to, and they had straight teeth. All of them had straight teeth. They had room. They had all their wisdom teeth. If you go back and look at skulls from way back when, they have nice straight teeth, and they have all 32. Our jaws are getting smaller, and we really need to focus on treating the why behind that, instead of just like, oh, now you're 17 and let's just take these wisdom teeth out, right? We as dentists just need to do better, I think. And I think a lot of it is in dental school, I was taught just take the wisdom teeth out. They just don't fit. There was no explanation, none at all. And so dentists just don't have, I've gone to so much more continuing education. I'm really passionate about treating root cause. And so I really pursued it as a dentist professionally. And so I offer that type of thing to my patient. But yeah, a lot of dentists they just don't know, right? We don't learn about facial growth and development in dental school. We don't learn about true preventative dentistry.
It's pretty incredible what you can do if you get ahead of it when it comes to the teeth and the bone growth and just all these other interrelated issues. And if that's something that resonates, rings a bell, by all means, check out some of our earlier podcasts. We have a number of episodes where we go deep on this. We promised that we were going to drop the wisdom on wisdom teeth today, and Dr. T, as always, you delivered. I think you gave a lot of actionable insights and really helped clarify something that a lot of people get confused with. Remember, your mouth matters, your knowledge, your education, your empowerment matters, and we at Green City Dental believe in you and your ability to make empowered, informed choices. So if you're ever in a situation where that doesn't sound right, I want to get second opinion, I want to know more, we're here to help you make a great decision and come to a conclusion that's going to be the best conclusion for you.
Yeah, and if you have imaging, and I'm happy to do like virtual second opinion consults too. I do that sometimes with patients that are out of town. If you have had a pano x-ray or you've had a CT scan, we can pop on like a VC, like a virtual platform, and I can also just talk with you about what your options are and consult if that's something that resonates or you would like me to do. So,
I love it. All right, Dr. T, thank you. Thanks for being here. Thanks for spreading the good word, educating the people, and letting everyone know who's affected by this issue, what some of your options are, because you do have options. Until next time, your mouth matters and your wisdom teeth matters. We'll catch you later.